On March 15th of this year, I joined a national nonprofit called SAFE Project. It stands for Stop the Addiction Fatality Epidemic. You guys have known I've been continuously moving upstream to address the root causes that, if left unresolved, could result in suicide. Sadly, we needed to use the suicide crisis to get people more comfortable about talking about mental health. And now, through some great leaders, we've really put the focus more on wellness, physical health, and the intersection with emotional health. And then our friend, Rob McKinney, and his focus on mental fitness. We've taken the stigma away when we focus on this as a strength. And we focus on the prevention and recognize that the human body and brain is going to be fatigued. It's going to get tired. We're going to have periods of up cycles and down cycles, and we need to learn how to better manage those stressors and develop coping skills and strategies and learn new techniques to connect with people and to let people know I'm not okay. And that's all happening. But the one burning need that has been hard to address has been substance use, substance misuse, substance use disorder, addiction, treatment and recovery, and the overdose crisis. So I'd been partnering for about 3 years with SAFE Project as a nonprofit that I knew, came to trust, deeply respect. In some ways, it's like a vertically integrated nonprofit. So there is a senior director of SAFE veterans and caregivers, SAFE communities, SAFE choices for K-12 schools, SAFE campuses, and then SAFE workplaces. I'm the senior director for SAFE workplaces. And just in the 3 months I've been there, to be able to collaborate between each of those portfolios with the other senior directors, we're able to show this as a comprehensive solution-based approach and to tackle the really tough issues that are systemic, that have barriers that keep people from getting help. So Jeff and Nathan, in the work I've done, it's been hard to get a lot of articles written about substance use and substance use disorder. Up until the pandemic, we could write about drug testing. We could write about drug-free workplace policies. But with the onset of the pandemic, several publications agreed that we should do more, that we should be emphasizing the prevention side, teaching people the limitations of drug-free workplace programs and the limitations of drug testing programs, and to share more resources with employees and their families about substance misuse, and then giving them gateways for recovery through treatment programs. So it's come full circle, and I needed to do this. It just became irrefutable that this was the next move in driving this forward. And if we could teach the army of helpers that we built around mental health, mental fitness, suicide prevention, teach them about addiction, treatment, and recovery, we could impact hundreds of thousands, if not millions, of people.